I'm Emily. We all know each other. I am doing a presentation on neonate medication administration, and this is for my BSN class at Waldorf.
Okay.
So this is why I'm doing it. If you guys have any questions, well, as we go through, you're more than welcome to ask. But my plan is to do the presentation, and then once we're done with the presentation part, I'll shut off the recording. We'll go through the skills checklist, the case study, and then we'll be done. So hopefully we'll be.
Dim the lights on that side so you can see the screen better. I can just do that half as through. I know it helps sometimes.
Yeah,
That'll help you follow.
Yeah, it
the
does.
mouse.
yeah, it does help, yeah.
Takes the layer off.
Yeah.
Thanks,
good idea.
Dave. No problem. Awesome. So our learning objectives are describing issues with neonate medication administration. And by the time we get done with the case study, you should, in the presentation, you should be able to identify that. Identify what a neonate is, define that by the end of the case study. And demonstrate medication administration orally, rectally, intravenously, and intramuscularly by completing the skills check. So definitions, neonates are a baby that is by the date of birth plus 27 days. So like a full-term baby's born at 40 weeks, it's their birth date plus the 27 days. It's also described as a preterm baby that is their date of birth through their expected date plus the 27 days. So if you have a baby come in born 2 weeks early and say they're due February 14th, but they're born February 1st. So their neonate is their birthday plus the 14th plus 27 days after that. So it's an extended period, longer. Challenges with neonate medication. So oral delivery is not an option when the neonate is critically ill or not taking anything by mouth or tolerating by mouth or not swallowing. This is because they can aspirate due to not being able to swallow. Another one is most medications used in neonates have been formulated for adults, with very few being packaged specifically for neonates. Even like Tylenol, they recommend like a month or older. So finding stuff that's actually for neonates is hard. This volume required for appropriate oral dosing of solutions and suspensions is often too small to replicate delivery at the same dose. So that's why they don't prescribe a lot of neonate medications, because it's so hard to get the 1/4 of a milliliter or whatever they need. Care must be taken to avoid too much fluid for neonates at once. Babies are small, they don't have a lot of blood volume. So the more you give them, it's going to be quick to overload them. Placement of a line can be very challenging aspect of delivery via the IV route. Again, they have small veins, small babies, small stuff. So the best is the foot or the hand. They have a small, or they can do everything like the leaking, the phlebitis, the edema can all be a part of what happens. They actually recommend axillary PICC lines for babies if they need it for long term, because they're 12 times less likely to have line-related complications other than the site of insertion. Like I said, the best place is either the foot or the hand to help with that. When intramuscular injections are difficult to deliver because of the limited muscle mass and how small they are and their limited blood flow for the first 2 to 3 weeks of life. So they recommend the upper thigh for that. And then because the rectum is so small, neonates is common for drugs to be unintentionally administered into the proximal rectum, so it's pushed too far in. So although they're less invasive, it can be useful when neonates are vomiting or suffering from diarrhea. The rectal route is good alternative in emergency situations, but needed access is not immediately accessible. Although rectal administration can result in some initial discomfort to the neonate, quick administration followed by the soothing of the infant usually results in successful treatment. So doing the rectal and then. I also think, oh, sorry, oral is by mouth, intravenous is the vein, intramuscular is in the muscle, and rectal leads in the rectum. So ways to administer: oral, intravenously, intramuscular, and rectal. So orally. IV here. Now make sure you check the order on your computer. You're gonna go through the 6 rights, so the correct patient, drug, dose, time, route, and documentation. You can check the baby's patient by checking their armband with the name, the date, and the MRN in your computer. You'll scan the bracelet. We don't have. Put on our glove. We'll draw up the medication using a syringe. Browsing up the medication. Make sure to keep the baby in an upward position. And when you give it, you're going to give it in the inner cheek or let them suck on the syringe. Give a small amount of time. One of the researchers I read said less than half a milliliter at a time, just to give them time to swallow it. So we'll swallow it. Make sure to dispose of your gloves in your syringe. Wash your hands, perform your hand hygiene, and document in your computer the amount you gave, where you gave it. The next one is IV use, so, or intravenously, so put the IV in like you would. Again, check the order. Do your 6 rights. Again, check, make sure it's the right patient, dose, time, all that fun stuff. Scan it, put your gloves on. Prepare the medication. So the medication we're gonna prepare. It says to scrub the IV port for 20 seconds with our alcohol wipe. Flush with half a milliliter normal saline so we don't fluid overload. Connect your medication. Administer your med. Flush again with a half a milliliter normal saline. Close all of our clamps. Discard our equipment and our gloves like we would. Perform our hand hygiene and document everything into the computer. Intramuscularly, apply that here. Again, check the order, perform our 6 rights, get our gloves on, scan our patient's stuff. We're going to draw up the medicine using a large needle. Start. Once we get the medication you need, you'll take that off and you'll put in a 25 gauge needle, 16 millimeter needle. Just so babies are small, they have little legs, not much fat, so we're not going to go pretty much. Make sure you take the baby's outfit off so you can see where you're going. Clean the area again with our rubbing alcohol swab. And then we're going to inject at a 90-degree angle. Make sure that you inject it slowly. That'll help with the discomfort of the medication going in. We're going to remove the needle, apply the pressure with a cotton ball. You can put a Band-Aid on. Then we're going to make sure that we're going to assess the area for any inflammation, the redness, the swelling, anything like that. Make sure to dispose of our drugs or gloves or syringes or needles. Perform our hand hygiene, and then document everything up. And then the last one is rectally. So check your order again. Do your 6 rights. Check the wristbands. Make sure to scan the wristbands. Make sure it marks up. Scan your medicine. We are going to don our gloves, and then for ours, got our depository here, which I'm not going to actually. We're going to position the baby on their left side, their lower leg straight, and their right leg bent. We're going to make sure that we put it in our loop, which I have here. Spread it open and make sure that the pointed end goes in the rectum first, which is called the apex. And it'll go in about ½ inch to 1 inch. And then hold the baby's bottom together and keep them laying down for about 15 minutes. After that, you can dispose of your gloves, your hand hygiene, and document your intervention. Anybody? Any questions? So you should have a case study. We'll just go over you can work together to do your case study.
Okay.
So the first, it's the scenarios, a new mother brings her 3-week-old baby who was born full term into the ER after the baby spikes a fever. The baby's weight is attained, it is 10 pounds, 8 ounces. The mother states the baby has not been feeding well the past 2 days. The baby is lethargic in response to pain. The baby needs acetaminophen administered PO or rectally, IV fluids, and a shower reception. Lifeline is called and on the way. You are the nurse taking care of this baby until the lifeline arrives. So the first question is, does this baby classify as a neonate? Why or why not? And we'll go over the answers afterwards.
You want to do that now by ourselves or just as a group?
We'll do it as a group. I'm gonna go over the questions first and then I'll come up
Okay.
with wording.
Okay.
The next one is the Herceptin is ordered 15 milligrams per kilogram per dose. Describe the place and process of administering this medication. Acetaminophen is ordered for PO or rectally. Describe what route you would administer the medication and why. The patient's blood sugar was reported during lab at 45. Normal is 70 to 150 for blood sugar. Oral dextrose needed to be administered. Describe the process of administering the medication. And then Lifeline is 10 minutes away, but would like a bag of normal saline started. Describe how much normal saline to flush and what to watch for. Put this in. Maybe. I'm gonna stop the recording part, just so when we go over the answers and stuff. I will post the presentation also on the portal. So, for you guys that are there, we're gonna go over the case study. I'll post the case study, the answers, and the presentation on the portal. That way you guys can look over them, or I can print off some extras and have them at the nurse's station too. Does anyone online have any questions? Okay, I'm gonna end it for now, and then I'll post the rest of the stuff. So thank you guys for coming.